Hi, I'm Dr. Mike Milligan. I'm here with Ryan Sullivan of Home Sleep Delivered. Ryan, thanks so much for being with us.
Thank you.
All right.
How are you doing?
Oh, I'm doing fantastic, and this is really important. Sleep apnea, there's so many people have that, and now dentistry has a way that we can help these patients. And the home monitor, the home sleep study is one of the things that you provide, or the main thing you provide. So tell us a little bit about Home Sleep Delivered and this wonderful monitor that the patients can get to do the home sleep study.
Well, what we do is we come directly to your patient, we contact the patient, we handle the delivery, we handle the payment. It's a maximum of $350 to the patient.
Okay.
So we keep costs minimal. It's about a quarter to a fifth of the cost of an actual conventional sleep lab study. Not to mention they get to do it in the comfort of their own home, in their own bed.
That's huge too.
Yeah, and one of the biggest problems the sleep lab and doctors have is getting the patient to go and do the test, because they don't even want to get hooked up with the wires, have someone watching them sleep, and some people just can't sleep out of their own bed. So
I've heard that they went to a sleep center and just couldn't even fall asleep the whole night. The whole thing was blown, and it can be a big expense too.
I'm actually a sleep tech, and so I worked at a sleep lab, and it takes an hour to get people just to calm down, so that they can get in a sleep mode, and if they even can. And half the people only sleep a couple hours. Some of them have to sign an affidavit in the middle of the night because they're like, I'm going home. I can't handle this.
So we've got this home sleep study, and so that's a way that they can be very accurate, and people can do this for a lower cost and feel comfortable in their own bed. So it's a wonderful way to do the home sleep study. Tell us a little bit about your device and how you do that.
Okay, well, we use the Bravon Metabyte and the Metabyte Junior, which records different than almost every other home sleep test because it uses direct sensors to record airflow with a nasal oral cannula. It's the only one that actually records mouth breathing.
So this is the way this whole kit comes.
Correct. It's very simple.
Just a little tiny kit. This is even opened up.
We have a little one-sheeter that takes 3 to 5 minutes to read. We have a 3-minute instructional video for patients to watch.
Very simple to put on there.
We have a 24-hour support line. It's very self-explanatory. Basically, it's 3 wires. It has a belt that measures respiratory effort so that we can pick up central sleep apnea. It has a cannula that measures, like I say, nasal and oral breathing. And then it has a finger probe that measures oxygen level, oxygen saturation in the blood, and a pulse rate. The unit itself also measures positional apnea so that you can see what your apnea is on your back, on your side, on your stomach.
Makes a big difference.
It makes a huge difference. A lot of people only have apnea on their back. So in a combination with using an oral appliance and positional therapy, you can get people to a minimal AHI, if anything. So it's very important to be able to see exactly what they do in each position.
And then you get the report, and then you get the information, you upload it to you, or send the unit back to you, and then we get this report that tells us exactly what we need to know with a diagnosis by a board-certified sleep.
Correct. All we need is a one-sheet referral form that you fill out a basic face-to-face evaluation of what symptom they have, what physiological symptom they have that can insinuate that they do have sleep apnea. And this is basically just for insurance coverage. We have to collect this stuff so that insurance will pay for it. And then we have a panel of board-certified sleep physicians that read the studies and get the results back to you with the recommendation of the oral appliance so that your patients can get reimbursed for the oral appliance, which is key because not many people can get a sleep physician to recommend the oral appliance. There's CPAP, CPAP, CPAP.
Absolutely.
And so, our doctors are more open-minded, and since the compliance rate for CPAP usually isn't even 50%, they want treatment. You can't let these people fall between the cracks. You can't let them just go with apnea forever. And
huge medical implications. So with this system, you don't purchase the system. The dentist doesn't have to purchase this system. They send it directly to the patient, minimal charge for it, very accurate because it's in their own home. They'll actually do this. Now, why don't we show people how to strap this thing up?
Okay, it's fairly simple.
Okay.
Okay.
Here we go.
Basically, comfort is key with the home sleep test. So this belt is basically, it's measuring respiratory effort, and it needs to be snug, but it doesn't want to be uncomfortably tight. So you put the sensor in place right about around your sternum, so that it's measuring body position accurately. And then
that was easy.
Yeah, there's only two other things to plug in. There is the finger probe that measures your oxygen saturation and your pulse rate, and it's got a little red dot to mark
you
to
can't
line
put
up
this in the wrong place.
Yeah, it's very self-explanatory. Just clips in like that. And included in the package is a little roll of tape so that you can keep everything in place, so that things don't move around at night. You basically just run it down your arm. A lot of times you can just tape it on your arm so that it doesn't move.
Or inside your sleeve.
And you just slip this on your finger all the way to the end. And there's even a picture of a finger so that you know which side to put it on. It's got a fingernail, and so it's very self-explanatory.
That's easy.
Then there's the nasal oral cannula, which is very similar to an oxygen cannula that you would see in a hospital if someone were receiving oxygen. So, let me untangle it here.
Very light.
Yeah, very light. It's just goes like this. And cinches underneath your chin, and then screws into the top right here, and you're hooked up.
I'm hooked up. I'm ready to go, and I'm kind of getting tired. I think I'm going to go to sleep right now.
Yeah.
So it's very simple.
And this unit stays within all the guidelines of the AASM. And it's the only unit that uses the exact same sensors that are used in the sleep lab. Every other unit uses algorithms and different ways of picking up the actual readings that you need to diagnose sleep apnea. So the Brabon is the unit that we use. We feel like it's the most accurate, and it's going to be able to diagnose your patients accurately. And
very comfortable.
Yeah.
No charge to the dentist have to have these on hand, and
what we do, we try and stay as hassle-free to your practice as possible. We take care of everything. All you have to do is send us basic information on the patient, and then in 5 to 7 days at most, we get you a report that recommends the oral appliance with all the information you need to explain to the patient exactly what's going on with them, so that they can be more educated and be excited about treating their sleep apnea.
Ryan, thank you so much.
Thank you.
Okay, great.